Hi, I'm Nurse Anissa and I work with Dr. Perry Gidalovich. Today we will look into the consent for the brachioplasty. The brachioplasty could be done under general anesthesia but could also be done under local anesthesia. It all depends on what was discussed during the consultation with Dr. Perry. The risk associated with the general anesthesia would be an allergic reaction. If we do give you medication and you have a reaction that you've never had in the past, we have medication to counter it. Nausea and vomiting is another risk with general anesthesia. We do have medication also to help you with this. And a phlebitis would be a blood clot in your leg. If you do general anesthesia, we will send you a prescription directly to your pharmacy for compression socks. It will be important to wear them for 2-3 days after the procedure as well, but you need to bring them with you the date of the procedure. Risk associated also with general anesthesia would be a throat pain, and that would be caused because of the intubation, and numbness of the hand because of the IV that will be put in your hand. Risk associated with local anesthesia would be pain at the injection. So she will freeze the fat and also all of the skin that she will be removing. That will be uncomfortable but not painful. Allergic reaction would be also a risk with the local anesthesia, and palpitation because there is epinephrine that is in the medication that we infiltrate. Risk associated with the brachioplasty would be bleeding or a hematoma. So if ever you have one arm that is bigger than the other, purple-ish color and more painful than the other one, it's important to contact us at the emergency number that is at the bottom of each document of the post-op. Other risk would be infection. We give you antibiotics to take for 1 week. Swelling is normal, and also having bruising, it's also normal after a brachioplasty. There is a risk of bad healing, wound delays, and that would be caused with the heat mostly, or if your body is rejecting the sutures. It's important to stay away from the heat and to avoid any physical activities for 1 month. You have a risk of a trauma of the nerve also in your arm. Most of the time the numbness will come back after 3 months. With the brachioplasty, the scar could be visible. So depending on what was discussed, sometimes it's a small scar right here, and sometimes it's a longer scar that goes from the elbow all the way down. It is important to know that there's a lot of tension in this area, and that could cause also wound delays or delay of healing. After a heavy weight loss, most of the time it is common to have wound delays regarding this, so you have to be patient about it.